So hi, good morning. My name is Anthony and I'm a respiratory care student from the respiratory department. So what I'm going to do today, Mr. Phillips, is I'm going to administer oxygen because the doctor ordered you on oxygen to be put up to you. So first is I'm gonna wash first my hands, and then after that I'm gonna wear appropriate PPE, and then before that I also have to ensure to check the patient's chart for any important details into it. So I'm gonna go inside the patient's room already. So first is I'm gonna ensure the patient is comfortable, and then after that I'm going to assess, check their vital signs, and then after that I'm going to explain to them what I'm going to do. So Mr. Phillips, the doctor ordered you an oxygen to inform you again. So I have here an oxygen. So for you to know, this oxygen will be known because of its color. So you notice it's a green, and also with its label, there's a label of oxygen. And then before that is I'm going to explain to you some safety measures. So I already put a signage outside, put up a no smoking sign, because the oxygen, even though it's non-flammable, it will lead to combustion, especially being exposed to smoke or heat. And then please prevent from having any children from roaming around or even touching the oxygen to prevent from any accidents. And also, I have here being put the oxygen in a rack. This is important because to prevent from oxygen being fall off or being tipped off, and then I'll just have to ensure that it's being placed in a safe place. So first is I'm going to crack the cylinder to remove any debris. So after I'm done cracking, I have there the flow meter, the PASS. So first is I have to ensure that the device is in good condition, especially with the O-ring. If it's still not rough or any like missing connections into it. And then after that, I'm going to put this one, make sure that it's being inserted properly and it's tight. And then twist it. Then after that, I'm gonna suck the turn this one up. And then after you suck that one, we notice that the gauge will be suddenly goes up. So it says here 1000. So by the way, Mr. Phillips, I also have to inform you about this one, because you got 1000 pressure in this tank. We have to compute it with the tank factor of this one, which is 0.28, and then because it is an E-cylinder, and then because the flow that the doctor ordered you was 2, so we divided it with 2 liters per minute, so equivalent of that is the duration of how long this tank lasts. And then another is that if we notice this manometer to reach about 500, we also have to notify us directly to the department or the nurse station so that we can immediately replace this one, especially it's urgent for you. And now that I already set this one up, I'm gonna set the flow back to 2 liters. Make sure that there's air coming out, and then make sure that if we have the nasal cannula in place or whatever device that the doctor ordered, we're gonna insert it in here, and then we have to attach it to the patient. Make sure that they are comfortable before going out. And then once we already put this one, we also have to assess again the patient, and then make sure that the patient is in comfortable state and it's not too tight for them, especially for the cannula. And then for example, if the patient's no longer using this one, we have to turn this one off, remove the device, especially for example the nasal cannula, and then put it in a safe place, and it should be in a clean container. Then make sure that the flow meter is in back to 0, and then make sure we also have to put this one back to twist it to make sure that it's gonna be back to 0. And then we have to set it approximately high flow to make sure that the oxygen will be back to 0 again. And then we have to remove this PISS, or either we can just put it in place, but for me we have to remove this one if not in use, and we should also put a cap from this to this device especially if the patient's no longer using the oxygen. And then we have to put it on the side. And then once we're done, we are also done assessing the patient. We also have to wash our hands, remove the PPE, and we have to document everything if what we observed to the patient, especially the vital signs and its assessment.